Today I'm going to be discussing the schizophrenia spectrum. One of the reasons why I chose this mental health disorder is because I have lots of family members, so it's close to me, and I also have experience as an ACT team supervisor where I worked with community mental health individuals with severe mental illnesses in Texas and a lot of them had schizophrenia. So one of the things that also really bothers me is that Hollywood and the media usually portray individuals with schizophrenia as dangerous, and when in fact they're more likely to harm themselves than be violent towards others. Another new thing is that therapists typically have a difficult time working with individuals with psychosis, feeling that CBT therapy is not the best for them. However, in the last couple of years, they have developed CBT with psychosis, and we're going to talk a little bit later about how that is helpful for individuals. So in 1996, schizophrenia was classified as a biological disease of the brain, just like Alzheimer's or bipolar, and now it's referred to as a brain disorder. It is known that schizophrenia is partially caused by genetics and is likely to be inherited, meaning that someone in your family may have the gene that contributes to that. So it is a brain disorder because it affects the cognitive symptoms and thinking often, and the way that the brain learns and stores information. And often they have a hard time with their working memory and a hard time organizing their thoughts and making decisions. So the neurotransmitters are part of the nervous system that they believe is affected, that there's an imbalance in the neurotransmitters that play a big part in schizophrenia. And these are the chemicals in the brain such as dopamine, serotonin, and glutamate. And these dopamine is the chemical that controls the motor control, the reward and reinforcement, motivation, and it's known that individuals that have schizophrenia, that their brains seem to be more sensitive to dopamine. And glutamate abnormalities are memory and learning, affect the memory and learning parts that are affected with individuals with schizophrenia. And serotonin is the mood, the sleep, the anxiety, the sexual appetite, and those are known to play a role in the negative symptoms in schizophrenia. So there's a dopamine hypothesis that is believed that schizophrenia is caused by excess dopamine or extra sensitivity to dopamine in the brain. So now a new revised dopamine hypothesis believes that it is altering the neurotransmitter systems with the way that the brain receives and sends messages based on the dopamine. So the DSM-5 says that schizophrenia spectrum and other psychotic disorders are defined by the abnormalities in bizarre behavior, which is delusions, hallucinations, disorganized thinking and speech, gross disorganization, and abnormal motor behavior, such as catatonia, and negative symptoms. So in order to meet the criteria, there must be two symptoms from criteria A, and one of those two must be the delusions, hallucinations, or disorganized speech. And it must be present for at least 1 month. So in the DSM-4 used to have categories of types of different schizophrenia disorders, the subtypes that they would fit under based on the behaviors that they exhibited or were lacking. And in the DSM-5 it changed to remove those subtypes. These are the reasons were that they really weren't reliable descriptions. People with schizophrenia didn't often experience the same symptoms in this subtype because everybody's different. There was no difference in the brain functioning, and subtypes didn't predict the condition or the outcome of how they would respond over time. And scientists stopped using subtypes in their reports because it just didn't seem relevant. The positive symptoms. So positive symptoms are things that are added to, like new symptoms that people are newly experiencing. And those are hallucinations. And those can be auditory, visual, olfactory, or tactile symptoms that are they're newly experiencing. So negative symptoms are things that are different, things that are changed, that are less, that are taken away, and those can be withdrawal from social events or settings, lack of perspective and not understanding what's real and what's not, lack of pleasure, flattened emotions, just kind of being withdrawn, not really caring about what's going on, not being a hermit, not being connected to the friends or the supports, struggling in basic lives like not bathing, not taking care of themselves, not eating on a regular basis, maybe just having one meal a day, just forgetting to eat. Their houses may be messy, just no perspective as far as that goes. No follow through, which they call avolition, meaning they just don't follow through because it's hard to concentrate, it's hard to remember what they needed to do. Now there's ways to assess that you can use when you do an intake to figure out if somebody has schizophrenia based on more than just the bizarre behavior that you're seeing or being reported. And those are the positive and negative symptom scales. There is a SAPS, a SANS, a PANS. There's ones that include positive and negative symptom scales, some that just do negative symptom scales, positive and negative. But the most newest screening tool is the clinical assessment interview for negative symptoms called the CANES and the brief negative symptom scale BNSS. And this is so we can determine how many of those negative symptoms they're having or positive symptoms that are added to meet that criteria. So evidence-based treatment for individuals with schizophrenia is not just medication to treat the psychosis. So there's antipsychotics. Then also that treats the positive symptoms. The negative symptoms are treated sometimes by antidepressants so that they can have a will for life, so that they can all those withdrawn, so they have a motivation, a little bit of they can improve some of those qualities of the relationships that are being affected. So the things that is most is having all three, not just the medication. It is believed to be therapy, CBT for psychosis, and also creating support. Now the most beneficial for recovery is something like a wraparound program. There's the ACT team, the Assertive Community Treatment Plan, where there is a whole treatment plan of therapy, medication, a peer support, which is someone who has been is recovered or found a good place or is doing well and works to help other individuals with mental health issues. Getting them involved in working or volunteering or things in the community. So the best ones are usually to do all of those and to also catch it early. So there's a program called the First Episode of Psychosis, which states that 3 out of 100 people will have psychosis at some time. And the earlier you get the treatment, some people will never have another psychosis episode if they get treatment early. Now, other people with schizophrenia and other mental illnesses will still continue, but they'll have better outcomes like jobs and relationships, will be more successful, and they'll be able to, with the help of a full recovery treatment team and individualized plan, will be able to get help and to have a better quality of life.